A very good morning, Team Zimbabwe, and welcome to Africa and Beyond Television Network. Let us talk about what is happening in the nation of Zimbabwe. Doctors and nurses have promised to strike on February 29 over poor pay. And this is according to the union, which represents doctors and nurses in the nation of Zimbabwe. So, this is a developing story in Harare. Nurses and doctors, through their Health Apex Council, on Tuesday, said they will embark on a strike from February 29 to March 2 if the Health Service Commission continues ignoring their grievances over low salaries. In a letter to the Commission, the Council said health as an essential service are incapacitated is characterized by loss of value of the Zimbabwean dollar, price disparities and distortions, and hyperinflation, the health workers said. The Health Apex panel, on a numerous occasions, written to the employer, highlighting the plight of health workers. Sadly, to this day, nothing has materialized. Health workers are severely affected, it said. The council accused their employer of not engaging on remuneration and conditions of service exclusion of health workers on last year's cost of living adjustment. They also say there's been no review on health sector specific allowances while their basic salaries are too low as they now earn $10 at the prevailing official exchange rate. They also get a COVID-19 allowance as a cushioning allowance amounting to 250 US. The Health Workers Union said if their grievances are not immediately addressed, a strike was imminent. The health workers are formally giving a 48-hour notice from Monday, February 26, 2024 to Wednesday, February 28, 2024 for a collective job action the collective job action will commence on Thursday, February 29, 2024 and end Saturday, March 2 if the grievances have not been addressed, said the union. So we need to take a critical review of what is happening within this sector of health workers. So if you take a look on how nurses work, they are very important because their service is essential. Not everybody can be a nurse, which means that they need to lowest in the whole SADC region, if not in the whole Africa. So nurses and doctors, these are people who can be called in terms of emergency or when there are emergencies. And these are people who need to meet the basics of their lives. Just imagine that recently Mtuli and this team added more tax on sugar, which means the basic commodities have risen because almost every basic commodity we use, especially when eating, there is an element of sugar, which means everything will go up. If you go to Mazoe Orange Clash, from $3.50 to now $4.30 and above. And if you go to Pepsi from $1 for 3 to now $1 for 2, all those issues are affecting everybody. So when the prices go up and the salaries remain constant because of poor policies, for example, the tax which was added, what it means is the people will have to suffer. The people will continue to suffer and nothing will work. So the landlords will simply take a look and say, okay, you were paying $70 a month a room, you can be able to buy Mazoe. You can be able to buy sugar. You can be able to buy some other basics. So you see the cost of living going up. So the moment a tax is imposed, enough. Apart from that, if you are working as a nurse, if you are working as a doctor, and you are to retire, what it means is you are retiring and going home with nothing. Why? It's because the pensionable salary is too low, which means the same will apply to the day you leave. You are not going to get anything meaningful from the employer. So all these issues, they've affected the health workers so far. Not only health workers, but each and every civil servant is being affected. So personally, I love to see lives being preserved. I love to see people being getting health care, and we need to see that pain being reduced. Just imagine you get into the hospital, you are in pain, there is a nurse to attend to you, and the pain is minimized. It will be something great. You feel relieved. But it will be something else when you get into the hospital. You continue having your pain, no attendance, no what. It will be something else. So I hope and believe that this is going to be resolved, and I hope and believe that this is going to be dealt with without this public suffering so much. So, Team Zimbabwe, uh, to those who can assist, please, you have to read the message which is scrolling right down there. We are running a scholarship program, and this 2024, we hope to pay fees for some school kids, especially those who are in grade 7. That is something that is our priority. We need to make sure that we pay fees for textbooks. We need writing books. Also need uniforms. So if you can, please get in touch with me on the numbers scrolling below. And please confirm if you are indeed talking to me, either through a voice call or a voice note, so that you actually confirm if you are talking to me. We're also running a program where we intend to buy a 5 kilovolts generator, a welding machine, a drilling machine, and some other small tools which can be used for welding, because we intend to go to each and every school and weld some desks for our children who are actually learning seated on the ground. They don't have anything to write on, which means they are being affected each and every day. They do not have that comfort they need for them to study well. So we need to run this campaign. We'll be facilitating the welder for the welders to be doing the other things. But what we need are the tools of trade. So for those who can donate, please don't hesitate to get in touch with me, because we need to develop our communities. We need to make sure that our children are developed well. And for those who need some pictures, I will try to get some pictures for the schools, and we'll try to make sure that we work together and build this community. Thank you very much for coming. Thank you very much for the support. Please keep on supporting us each and every day.